In our Teeth Chatter segment this morning, we're talking about wisdom teeth. I was just thinking back as to when I got mine removed and that process. Well, talking about the process of it, Dr. Kris Tumilowicz is in our newsroom this morning. Hi, Dr. T. How are you?
Good morning, everybody.
Good morning. I was just thinking back to the procedure. You know, you have the great debate. Do you get the wisdom teeth out? Do you not? I remember just being, knocked out. It was done, and boom, I'm on my way home, off to bed.
Yeah, when you're young and healthy and you're not working full time yet, that oftentimes is really the best time to deal with the question about your wisdom teeth. And few people are lucky enough to keep them. They have room for them to erupt normally and in a healthy manner, and so you can keep all 32 teeth. But most of us are not that fortunate, and so we end up having too many teeth and not enough jawbone. We'll say people have 32 gallons of teeth, but they only have a 28-gallon mouth, And so here's an example of a wisdom tooth is trying to come in, doesn't have enough room, and it can come in at a severe angle, even destroying the adjacent tooth. So here this poor person has to lose both teeth because they didn't get their wisdom tooth out in time. Here we've stained the tooth to just demonstrate that it's hard to keep them clean. The plaque just is hard to reach, and so if you do have your wisdom teeth, usually they become decayed, especially with our refined sugar diet that we have so much in this country. And so if you're able to take care of that wisdom tooth early, you won't get a cyst around it. Here's an example of where there's really quite a bit of jawbone destruction around that wisdom tooth because of that cystic activity. And so if you have wisdom teeth, you may want to have them radiographed, check on an x-ray every so often. And you notice how the roots aren't fully developed yet. If you're a 17, 18-year-old teenager, usually those wisdom teeth roots aren't formed yet, and so it makes it easier to remove. And so you have an easier procedure and faster healing.
Because
so it's easier for you.
You don't necessarily, you don't need your wisdom teeth.
No, most of us survive pretty well with 28 teeth. And just anthropologically over the decades and hundreds of years, I guess our jawbones have developed in a kind of a smaller way. We don't have our large jaws like our Neanderthal ancestors did. And so we don't have room for all those teeth. And so usually if you're young and healthy, talk to your general dentist about how your wisdom teeth look. And if they can remove those for you, or they can make a referral to an oral surgeon if he chooses to do that.
Okay. And as an adult, that's a different conversation that you need to have?
Well, sometimes our adults keep their wisdom teeth too long, and then later on, maybe you're not enjoying good health. What if you have a heart condition, or if you're a diabetic that's having trouble with healing? That's not the time that you want to deal with wisdom teeth. So if you're maybe a junior or a senior in high school, or maybe just getting ready this summer to enter college, now is really the best time to deal with that issue. And it may not necessarily be true that you have to have all 4 wisdom teeth out, but many times that may be the case. And if you're going to be sedated or asleep, that's a good time to just take care of all of them all at once.
Absolutely. All right. Well, thank you so much, Dr. T. I appreciate you joining us this morning.
Okay, take care, everybody.
Take care. Well, if you'd like more information, of course, you can contact Dental Dimensions, 1619 North Alpine Road in Rockford, 815-229-3520, or find them at dentaldimensions.com. Well, after the break, we're going to talk about